in May, we introduced you to Bailey, the therapy dog at Texas Children's Hospital. When we met Bailey, she was on her way to a happy retirement. And while that was great news for her, it did leave a bit of a hole for THC until today. We are talking to Adair Winget, Bailey's previous handler and the new handler of Melman, the new therapy dog at the hospital. You know your name, good boy. Adair, welcome and thank you for joining us. Melman seems like a really good dog here.
He is a great dog. Thanks for having us again. We're happy to be back.
Yeah, so we'll get all to like everything that Melman does for the hospital. But first, how's Bailey?
Bailey is great. She is such a happy retired girl. She has so much energy. And so when Bailey was working at the hospital, she would give all of her love and her energy and emotion to everyone else. So when we came home, she really was calm and just kept to herself and just rejuvenated.
Yeah,
you know,
just
when
like
you come
people,
home,
it's emotionally draining to go and visit others and give to others
and constantly be giving. But now that she's not working, she has all this energy. She has a very puppy-like mentality, and so my husband and I feel like we have a whole new dog.
That's really sweet. I love that, and I love that you're still taking care of her. So introduce us to Melman. Seems super chill. Nothing's bothering him right now.
So this is Melman. He is our newest facility dog at Texas Children's. He is 2 years old and comes to us from Canine Companions in Santa Rosa, California. But he has been raised here by his puppy raiser outside of Dallas, Texas.
Yeah, and he will not be distracted. He is eyes on you.
Melman, look.
What?
Dear we are.
What has he been trained to do? Like, how is he able to help children in the hospital?
So all of our facility dogs come from Canine Companions, where they are actually all trained to be service dogs. And then once they go into their professional training, they decide whether it's going to be for service use, facility dog use, or even for veterans for PTSD.
Oh, that's
so they can really be able to see what their skill set is, how they adapt to multiple groups of people's settings, environments, and which commands are they more prone to and behave the best with.
And they were like, he'd be great for a hospital, visiting sick kids.
They say facility dogs are a renaissance dog, so they can adapt to anything and everything, which is harder than a service
Well, I mean, you
dog.
think about it, you've got all the beeping and the tubes and the moving carts. I mean, a hospital can be a very overwhelming place for a dog. Tell us about the type of encounters that Melman is going to have at the hospital. Like, who is he going to be visiting with?
So Melman and I, we have 5 facility dogs, so we all work in different areas, but Melman and I work in our Legacy Tower, which is our most critical patients in ICU, as well as our world-renowned heart center. So Melman and I do a lot of co-treating with physical and occupational therapy. Hi, buddy. He just wants to be on the conversation. So we do non-sterile procedure help support. We are there during difficult conversations, co-treating, and really helping to normalize and stabilize an environment for kids long-term.
Yeah. Okay, so we are talking about long-term patients too. So he probably gets to know some of them pretty good, huh?
Yeah, and a lot of them know Bailey previously, but now they're excited to meet Melman, and they feel excited that they got to know both dogs.
Well, Melman kind of looks like Bailey, right?
Bailey, they're the same color. Bailey was a golden retriever, and he's a Labrador retriever.
Okay, yeah, I'm not remembering that well. What's the reaction from the kids when they see the dogs?
I think it's such a positive reaction. I think in such a scary place that kids are not normally used to being in.
We are not paying enough attention to Melman, ladies and gentlemen.
He brings such like a familiarity to kids, because most people have animals at their home, and that's such a source of comfort and safety for them. And so when Melman comes into the room, they know, okay, no procedures are happening in this moment. They know Melman is a safe friend, he's secure, and he's trustworthy. And so they're able to really let their guard down and just get to be kids.
Yeah. Oh, what are the benefits of having a facility dog for the patients too?
Hi, buddy. He's like, let me tell you, there are so many.
He's
so
like,
one of our biggest
you can't just talk about me right in front of me.
I know. So one of our biggest things that we really love to work with in the ICU is having Melman there during different procedures or therapies. We're really able to lower the amount of medication, whether it's pain meds or sedative meds, to help during different procedures like extubations, IV starts.
Just because their stress level goes down?
Their stress level, you can see on the monitor their cortisol levels and their heart rate and their oxygen goes to a more therapeutic state. And so Melman is really able to help with that. And one of the best things is for our kids that are developmentally delayed or have any type of sensory issue, Melman provides a really deep therapeutic pressure, which helps to ground them.
Oh, wow, like a
so that means less
weighted blanket
people,
type
yes,
thing.
so it's less people holding kids, that's less stress, that's less anxiety on the parents watching their child have a procedure done. And Melman does a great job because he thinks people make great pillows, so he loves to lay on them and love on them.
So how old is Melman?
He is 2 years old.
Okay, so how long do they typically serve as therapy dogs at the hospital?
So they will serve as facility dogs between the ages of 8 and 10. Some work longer, some work right at 8. It really just depends on the dog, their energy level, and seeing how they are during their career.
Okay, and so over the next several years, he'll get to meet lots of kiddos at
He
Texas
will.
Children's,
He
and he's at
will.
the main campus in the Med Center.
He is at our main campus and medical center.
Okay, what else do you want people to know about Melman before we let you go?
That he is also a goofy boy. They're really serious when they're at work and they have a very serious face, but when we're not directly with patient care or when their vests come off or come home, they are very well taken care of and love dogs and have a really fun personality.
Yeah, why do you think he's trying so hard to get your attention right now?
Because he is a very working dog. We're still working on like just chilling and laying still because he wants to be like, what are we doing? What's our next command? What's our next task?
Oh yeah, he's got the puppy energy.
He's a serious boy.
Let's go do work. He's providing a little bit of a weighted blanket on my foot right now, so I'm not going to be able to let you go. I'm going to need him to stay there for the rest of the show. Probably be good for my health to have you here,
yes.
Melman. We love you so much.
boy.
Thank you for coming in. Good
Thanks
boy.
for having us.
Yeah, Adair Winget, thank you so much. This was a treat for us, believe me, and I know that you guys are doing wonderful work at Texas Children's.
Thank you.
Thank you for
Thank you.
coming in.